Basics of pregnancy from marrow. So, while calculating EDD and LMP, which is one of the most important things to do, first, there are three assumptions that we consider. One is the patient, the pregnant lady, had regular cycles before. The cycle length was 28 days, and day 14 of the cycle was the day of ovulation and the day of fertilization. So, considering three things, we calculate LMP. The total duration of pregnancy is 9 months with 7 days or 40 weeks or 280 days. The first day is the first day of last menstrual period. 14th day is the day of ovulation, and 28th day there will be missed period. That is 4th week of pregnancy. Period of pregnancy or gestation age we calculate from the first day of LMP, but fetal age we calculate from the day of ovulation, that is 14th day. So the difference between gestation age and fetal age would be 2 weeks. So gestation age will be fetal age plus the 2 weeks. So trimester wise, first day of last menstrual period with till 13 weeks with 6 days is first trimester. 13 weeks with 6 days. Second trimester is 14 weeks till 27 weeks with 6 days. Okay, and third trimester is 28 weeks till delivery. So first LMP in the 13 days 13 weeks 6 days. Next second trimester is 14 weeks till 27 weeks with 6 days. Third trimester is 28 weeks till delivery. Period of fertilized ova ಯಾವ ಫಾರ್ಮ್ ಆಗುತ್ತೆ up to 2 weeks after the day of fertilization. Embryonic period is 3rd to 8th week after fertilization. Fetal period is 9th week after fertilization up to delivery. Now let's come to the main topic, calculation of estimated date of delivery. Okay, so regular 28-day cycle. Introducing Neagle's formula. Neagle's formula is first day of LMP with 7 days and 9 months. Okay, so first add 7 days and then 9 months to it. We get the expected date of delivery. Exception is February. So this month is February. So add 9 months first and then 7 days. We have fallen into February in OBG. So add 9 months first and then 7 days. If cycle length is less or more than 28 days, avaga calculate approximate days in EV formula, then calculate the difference between the cycle length and 28 days. Iga cycle length is more than 28 days ide anta anko, add the difference to the approximate ED. Like 30 days idre you have to add 2 days to the LMP. Whereas if the cycle length is less than 28 days, then subtract the difference. So if it is happening at 26 days itself, then minus 2. Neagle's formula is not applicable in pregnancy due to OCP failure ಆಗಲಿ ಅಥವಾ ಲ್ಯಾಕ್ಟೇಷನಲ್ ಅಮೆನೋರಿಯಾ, irregular cycles ಇರುವಾಗ, unsure about LMP, then we cannot consider Neagle's formula. We have to go for USG findings, that is crown rump length. In case of IVF, how do we calculate this? Fresh IVF cycle ಆಗಿದ್ರೆ day 14 of the cycle is the day of fertilization and the day of oocyte retrieval. So EDD is equal to day of fertilization with 266 days add ಮಾಡ್ತೀವಿ, not 280. Already will minus 14 days, no, 266 days. Whereas frozen IVF cycle ಇದ್ರೆ day of fertilization will not correspond to day of oocyte retrieval. ಆಯಿತಾ? So day 3 transfer ಥರ ಇದ್ದರೆ ಅವಾಗ day 17 of cycle will be the fertilization. So EDD will be equal to date of day 3 transfer with 263 days add ಮಾಡ್ತೀವಿ. Day 5 ಇದ್ದರೆ day 19 ಅಲ್ಲಿ fertilization ಆಗುತ್ತೆ. So date of the day 5 transfer on and plus 261 days. Coming to different terminologies, preterm pregnancy is when the duration is less than 37 weeks. 37 weeks preterm pregnancy. Term pregnancy is 37 weeks to 41 weeks with 6 days. Okay, so what is a term pregnancy? If anyone asks, it is 37 weeks in the Shivagi till 41 weeks with 6 days. In this early term is 37 weeks till 38 weeks with 6 days. Full term is 39 weeks till 40 weeks with 6 days, and late term is 41 weeks to 41 weeks with 6 days. Post-term pregnancy is after 42 weeks. Abortion is pregnancy loss at less than 20 weeks. IUD ಏನಪ್ಪ ಅಂದರೆ is pregnancy loss after 20 weeks. Okay. Preterm, if you have to classify, preterm what I said is less than 37 weeks. So early preterm is less than 34 weeks, late preterm will be 34 weeks to 36 weeks plus 6 days. Okay. And WHO class idu ACAG prakara, that is only most commonly used. If you have to know WHO classification, it is late preterm birth. Late preterm, see preterm is less than 37. Late preterm andre 34 weeks to 36 weeks plus 6 days will be late preterm. Moderate andre adikkinta kadme irutte. So 32 weeks with 32 33 weeks with 6 days. Very preterm babies less than 32 weeks. Extreme is less than 28 weeks. So if you go in ascending order, extreme preterm is less than 28, very preterm is less than 32, moderate is 32 to 33 weeks plus 6 days, late preterm is 34 weeks to 36 weeks plus 6 days. So intrauterine fetal death is after death of fetus after 20 weeks. That is only stillbirth. So what are the causes for stillbirth is, one is idiopathic and unrecognized IUGR. So unrecognized intrauterine growth retardation is the most important single cause. WHO definition is IUD is pregnancy loss when fetal weight is more than 500 grams. Stillbirth is pregnancy loss at more than 28 weeks. How do you diagnose stillbirth? See, normally the definition is after 20 weeks, but according to WHO it's after 28 weeks, or if the child is the fetus is more than 500 grams. Diagnosis is based on this NST or USG study. After 32 weeks, we consider modified biophysical score or NST. Less than 32 weeks, we consider USG. So what are the USG findings is, first of all, there will be absence of cardiac activity. Next, Spalding sign will be seen, that is fetal skull will be collapsed. So there will be overlapping of skull bones. That is Spalding sign. Roberts sign is the first sign seen on USG, where there will be bubbles in the great vessels of fetus. Bubbles. That is air bubbles. Ball sign is hyperflexion or hyperextension of fetal sperm, because all tone will be lost. Crowding of ribs is also seen. So three signs: Spalding sign, Roberts sign, most important, and also Ball sign. Rarest complication is DIC, disseminated intravascular coagulation. Risk factor is dead fetus retained more than 4 weeks inside itself. Avaga diagnosed case of IUD 2 or 3 weeks back, coagulation profile to be done. Okay. Management mode of delivery is vaginal, because the child would be very floppy, thin, it can easily come out. Spontaneous labor or induction can be done and removed. Indications for C-section is done only when there is placenta previa, so maternal causes, placental previa, or the child is transverse, we cannot remove in vagina. But obstructed labor or more than 2 previous LSCs, we go for C-section. Coming to the important concept of obstetric score, gravida. Parity, we'll see all of this. So gravida is number of times the female has conceived. It includes past and present pregnancies included. Parity is the number of previous pregnancies that have crossed viability. This will not include the present pregnancy. Period of viability is the period beyond which the fetus is capable of independent existence. It is 28 weeks. So we have different methods of illustrating. One is just gravida parina GP, and one is GPA, abortions. And GT PAL is the best method, where G is gravida, P is parity, and P, A, B, C, D is there. So A is number of previous term pregnancies, B is number of previous preterm pregnancy deliveries, C is number of abortions, and D is number of living children at present. Multipara is female who is given birth more than 2 times. Grand multipara is who is given birth for more than 5 times. Remember this, more than 5 times is grand multipara. So we will get to see many grand multiparas. Multiparas so common. Primary is one who is conceived for the first time. Elderly primary gravida is female who is conceived for the first time after 35 years of age. She is elderly primary gravida. Multigravida is female who is conceived after 2 times. Coming to signs and symptoms of pregnancy. So you have presumptive signs, that is felt by the patient. Definitive, that is presumptive symptoms. Definitive signs is diagnosis of pregnancy, and probable signs are felt by examiner. So the first trimester, what are the probable signs you see that is just felt by the examiner is Goodell's sign is the first sign to be positive. Goodell's sign. Seen in the 6th week. 6th week of pregnancy, where softening of cervix occurs. Goodell sign, softening of cervix. Piscacic sign is seen in 8 weeks. Rest all the signs that I tell also will happen in 8 weeks itself. So Piscacic sign 8 weeks, where there is asymmetrical enlargement of uterus due to eccentric implantation. Eccentric implantation and the asymmetrical enlargement of uterus occurs. That is Piscacic sign. Osiander sign also occurs in 8 week. Pulsations is felt in the lateral fornix of vagina due to increased uterine blood flow. You can feel for the pulsations. Chadwick or Jacquemus sign seen in the 8th week again, where there is bluish discoloration of cervix and vagina. Palmer sign seen in the 8th week, where there is rhythmic uterine contraction. Hagar sign is seen in the range of 6 to 10 weeks, where if you bimanually palpate vagina and abdominal fingers, if you approximate, you can approximate. That is due to isthmus, empty and soft in the early pregnancy, so you can feel for it. When it gets harder, you cannot feel. Definitive signs of positive signs in pregnancy is gestation age with yolk sac or fetal poles. Cardiac activity is positive on USG. So definitive signs in pregnancy is gestation sac with yolk sac if you see, fetal poles if you can see. Cardiac activity is present, fetal heart sound is positive on auscultation, fetal parts is felt by the examiner. All these are definitive signs. So we have pseudo cysts or false pregnancy, patient presumes or fakes pregnancy, definitive signs are absent. Fetal skeleton is present on X-ray, definitive sign. Preserved symptoms which is carried by the patient in the first trimester is amenorrhea because of increased progesterone, morning sickness due to HCG, where nausea and vomiting is present in the first 3 months. Urinary frequency will be increased due to the uterus growing, which will irritate the bladder. Breast tenderness is also seen. Other symptoms are breast changes, increased pigmentation, all of that occurs. Height, size of uterus in the 6 to 8 weeks is comparable to pear, 8 to 10 weeks to orange, 8 to 12 weeks, 10 to 12 weeks to grapefruit. Height of uterus increases by 1 centimeter per week after 4th week of pregnancy. Till then it won't increase much because all these small changes will keep occurring. After 1 month, 1 centimeter per week increase. Pelvic organ at 12 weeks, height of uterus is equal to pubic symphysis. So this is all in first trimester. The probable signs of pregnancy, definitive signs and presumptive symptoms. In the second trimester, the symptoms are nausea, vomiting will subside usually because HCG will also drop after 16 weeks. It will reach its minimum levels. Urinary frequency will decrease in the second trimester because uterus becomes an abdominal organ, so it will no more irritate the bladder. Quickening will be felt in the 5th month. This is an important aspect of second trimester. It's the first sensation, it's a perception of fetal movements by the mother for the first time. Primi gravida, it occurs at 18 to 20 weeks. Remember this, 18 to 20 weeks, and in multigravida it occurs in 16 to 18 weeks. Braxton contractions is onset 16 weeks. Braxton contractions occur and it keep increasing near term. It's a painless uterine contraction. It will not lead to cervical dilatation. It's a benign thing. True labor pains are painful. It leads to cervical dilatation. Signs is fetal heart sound will be heard. Handheld Doppler in 10 weeks itself, but instead for steth to auscultate for fetal heart sound, it should be 20 weeks at least. Remember this. Then internal ballotment, head of baby pushed upper vaginally, head strikes the opposite end of the uterus and returns to touch the examiner's hands. This is internal ballotment. External is baby pushed from one side upper abdominally, strikes the palm of opposite hand. So this is sideways. Cutaneous changes with breast changes prominent in second trimester. Linea nigra, stria gravidarum, chloasma. Third trimester symptoms during third trimester: increased urinary frequency due to irritation of bladder by the fetal head. Increased urinary frequency, respiratory discomfort is seen, increased uterine height, diaphragm is pushed up, increased breathlessness. Cutaneous changes, that is all these linea nigra, stria gravidum, chloasma. with breast changes will be very prominent in second trimester. So in second trimester, we saw internal, external, allotment, fetal heart sound, some of the changes, and symptoms, nausea, vomiting will reduce, urinary frequency will reduce, quickening and Braxton contraction. So also about mechanical movements here. Third trimester, symptoms during third trimester, again urinary frequency will increase because of irritation of bladder by the fetal head. Again it will start coming to pelvis. No? Respiratory discomfort will increase because uterine height ಮೇಲಿಂದ ಜಾಸ್ತಿ ಆಗ್ತಿರುತ್ತೆ, the diaphragm will be pushed up, so there is increased breathlessness. Pedal edema is seen due to pressure of the gravid uterus. Backache. So height of uterus at 12 weeks it is at the level of pubic symphysis. At 16 weeks it's midway between pubic symphysis and umbilicus. 20 weeks it's the upper border of umbilicus. 24 lower border of umbilicus. 24 upper border of umbilicus. 28 weeks, 1/3 of distance between umbilicus and xiphisternum. 30 to 40, 2/3, and 32 or 40. 36 weeks it's at the level of xiphisternum. So 32 and 40 weeks is at the same level, 2/3 distance between umbilicus and the xiphisternum. So how do you differentiate is fetal head on per abdominal examination is not felt in 32 weeks, fetal head, whereas 40 weeks it is felt. Flanks will be empty in 32 weeks, whereas flanks will be full in 40 weeks. At 36 weeks, what happens? Because it goes till the level of xiphisternum, there is excessive breathlessness because diaphragm is pushed. Head of baby, diaphragm will ascend up. Head of baby will, as and when head of baby descends into pelvis, the height of uterus reduces to the level of 2/3 distance, 32 weeks. So at 40 weeks, the height of uterus will be equal to 32 weeks. So that time there will be relief from breathlessness. That's called relief sign, welcoming sign. Usually fundal height in centimeter is equal to the period of gestation. If it does not correspond, next step is to get USG done. If there is discrepancy of 3 centimeter or 3 weeks, then pathological cause is the most common. 3 weeks. When will the height of uterus be more than period of gestation? So when it is bulky. So what does it mean? Full bladder, the wrong dates, polyhydramnios, or twin pregnancy, molar pregnancy, concealed abruptio, macrosomia, or intrauterine fibroids. When will the height of uterus be less than the period of gestation? If wrong dates again, and intrauterine growth retardation, IUD, transverse lie, uteroplacental insufficiency, PIH,